So I'm going to tell you about the Meyerhoff Scholars Program at UMBC and how it might help develop a workforce that could help with this. Actually, we have quite a few of our Meyerhoffs who are now doing bioethics research. They were Robert Wood Johnson Fellows at Harvard and things like that. So the Meyerhoff program was started by our president, Freeman Hrabowski. He's an African-American. He started at UMBC the same year I did in '87. At that time, the black students protested because they felt the campus was racist. They were holding sit-ins. Now we're the top origin of black MD PhDs in the country. We're number 2 origin of black PhDs behind Howard, or we were three years ago. We think we've passed Howard now. And we're considered a role model for inclusive excellence in STEM. The program started in 1989 just focusing on black males because that was of interest to Bob Meyerhoff. It was open to black women a year later, open to all students who care about inclusion a few years after that. And historically, we've been about 71% minorities in our program, of which most of those are African American. We receive support that's critical for this from the NIH, a lot of support from the NIH, HHMI, and private donors. Our approach is student-centered. We attract high achievers, and one of the things that I do every year is meet with high school sophomores and their parents, and we talk about things like health disparities. I remind them that at the turn of the last century, sickled cells were discovered, and it was 50 years before the U.S. government spent a penny studying the disease. And now there are gene therapy approaches that are going to disproportionately benefit black communities. And I've had 2 students, graduate students, who've really suffered from sickled cells. It's an intrusive program with high expectations, cohort learning, immersion in research. I don't have time to talk about it all, but a big key point is there is high exposure. In the same way that you saw panels of high-achieving minorities and women up in front of this group, putting these students in the front rows of classrooms changes expectations. We've had 1,500 total Meyerhoff participants, over 1,100 graduates, 91% of them graduated with a STEM degree. So these are kids coming into college at 17 years old and being retained in STEM. 312 have earned PhDs, of which 82% are minorities, 59 MD PhDs. You can see the numbers. We still have another 258 that are enrolled in PhD programs. Assessment is critical, and that's one thing that I tried to emphasize at lunch today. You can do all these things, but unless you can show quantitatively you're having an impact, you're not going to convince people that you're spending your money wisely. So what we did is we this is maybe an ethical question, but we got parents to sign waivers that say if we make your son or daughter an offer and you turn us down, that we can monitor you. So if we look at the students who turned us down and go to the Ivies, they tend to graduate with similar GPAs, but they're half as likely to graduate with a STEM degree, and they're 7 times less likely to pursue a grad PhD program in STEM. There's a broader impact that I want to tell you about. We've seen by 2005, so this is only after a little more than 10 years, we have 400% increase in non-Meyerhoff African-American STEM degrees awarded. GPAs by that point equaled, on average, the GPAs of the Caucasian students. The Meyerhoff components that we found work for minorities, work for all students, and they were being implemented across the campus. And by last year, African-American graduation rates for all majors, for all African-Americans, equaled or exceeded Caucasians. So there's been a huge change on our campus. We've had an impact beyond UMBC. The U.S. Surgeon General is a Meyerhoff. Sylvia Trent Adams is a Meyerhoff. We have 40 of our former students, Meyerhoff undergrads. We also have a grad program, but the undergrads have tenure track faculty positions. Here's some of their faces. And just to tell you where they are, 4 of them are on the faculty at Duke, 2 of them are at Stanford, 3 or 4 at Hopkins. These are all Research One universities. And the ones that aren't highlighted are at tribal colleges or smaller places where they wanted to go back and give to their communities. The program can be replicated. You don't have to have a black president to do this. That's what everybody said. We now have been partnering with help from the Howard Hughes Medical Institute with UNC Chapel Hill and Penn State to totally different places, totally different environments, different minority compositions. You know about the Silent Sam statue and the firing of the president. They're very different environments. And yet in year 1 with our partnership, they were outperforming the Meyerhoff program. They now have, after 2 years of endowment building, they have raised between the two campuses more than $30 million for their endowment in just over 2 years. That's because their leadership made it a priority. Requires like-minded administrative leadership. It's facilitated by interinstitutional partnerships. And it also needs what we've found that it helps to be backed by leaders in education reform. So the work at UNC and Penn State was backed by Howard Hughes Medical Institute, and now the Chan Zuckerberg Initiative is helping us replicate this at Berkeley and at UC San Diego. Berkeley, the impact could be huge because they're the #1 school of origin of undergraduates who get degrees in STEM, about 350 a year, of which about 5 are black in all areas of STEM. So we could have a huge impact by partnering with them. Thank you.